Hi, my name is Chris Sorrentino, and this is the series premiere of CombatCounselor Q&A, where each week I'll spend around 15 minutes talking to you about body-mind behavior therapy and mindfulness-based cognitive behavioral therapy. I'll also be willing to answer any questions that you might have, so if you have any comments or questions about this series, feel free to leave them on YouTube, or you can send them to me on Twitter at CombatCounselor, or visit my website. That's www.kccbt.com. You can send your questions or comments there. I'm currently writing a book entitled You Think You Are Anxious, A Journey from Avoidance to Acceptance. And in that book I highlight the therapy I called body-mind behavior therapy, which is a combination of things I've learned over the years, but primarily are based on cognitive behavioral therapy, as originally written about by people such as Aaron Beck, Albert Ellis, but have taken it to the next level in what we call the third wave of cognitive behavioral therapies and mindfulness-based cognitive behavioral therapies. For example, those by Marshall Linehan, dialectical behavior therapy, or Stephen Hayes, acceptance and commitment therapy, or ACT. Behavior therapy has come a long way in the last 30 years. When I was in school, in my master's program at California State University, Los Angeles, you could have called me a radical behaviorist at the time, because behavior therapy worked quite impressively. I was involved in research studies where we used operant conditioning to train animals to use apparatus. I was also asked while at San Diego State University to work with Shamu. That was with the original Shamu, the original SeaWorld. Back then, that was 1978. There weren't any other Shamus or SeaWorlds around. But I was asked to work with Shamu because of my skills as a behavioral scientist. And I saw behaviorism and operant conditioning work quite effectively with animals, and went on to see it work quite effectively with people. And even some of the most effective cognitive behavioral treatments today are behavioral. In particular, I'm thinking about exposure. Exposure is extremely effective and is used in many different treatments for different problems. For example, obsessive compulsive disorder is treated very effectively with exposure and response prevention, which is about as behavioral as you can get. So the behavioral aspect of it, being a radical behaviorist back then, and evolving over the years as we learned that behaviorism was not just the only answer. People do respond well to positive reinforcement and negative reinforcement, and not quite so well to punishment. But that's not the only answer. And B.F. Skinner thought it was, and several of the early behavioral psychologists thought it was. But then folks like Aaron Beck and Albert Ellis came along, Donald Meichenbaum, and realized that cognition was an important factor in behavior. And by cognition, I mean thinking. Matter of fact, the word cognition comes from the Latin root conoscere, excuse me, to which means literally to think. So cognition has been determined over many years and many empirical studies, scientific research studies, to be the basis for much of what we do, for our behavior. So if you think about it, every behavior, everything you do, every emotion you have is based on a thought. There's usually a thought that precedes it. So if you're depressed, there's usually a sad thought that precedes that. If you're anxious, there's usually a fearful thought that precedes it. So it's these thoughts that really drive our behavior. And folks like Beck and Ellis and Meichenbaum, who I had the pleasure of working with, or spending some time with, Albert Ellis and Aaron Beck, for just a short time at an APA convention back in the early 90s. And Donald Meichenbaum, much more extensively. I spent a week with Dr. Meichenbaum at the Cape Cod Summer Symposia back in the early 90s as well, along with a gentleman by the name of Theodore Milan, who is one of the most famous psychologists as far as psychological testing is concerned, and developed the MCMI and MCMI2, the Milan Clinical Multi-Axial Inventory. But anyway, going back to cognitive behavioral therapy, really changed the way we dealt with disorders, especially anxiety disorders and depression. The anxiety disorders being obsessive compulsive disorder, phobias, social phobia or social anxiety disorder, post-traumatic stress disorder. The list goes on. There's several anxiety disorders, and then the mood disorders, major depression, dysthymia, bipolar disorder, and the like. So cognitive behavioral therapy is extremely effective in treating those, and has been proven so in research study after research study. More recently, in the past 20 years or so, starting about the 1980s, a gentleman by the name of Stephen Hayes and Dr. Hayes and Dr. Marshall Linehan started working with mindfulness-based therapies, basically take it to the next level, and hence the term third wave was coined. I don't know if it was Dr. Hayes that coined it, but he's mentioned it several times in his books. But dialectical behavior therapy and acceptance and commitment therapy are really the new wave, the third wave of cognitive behavioral therapies. And when you look at them on the surface, they don't look very cognitive behavioral. Dialectical behavior therapy looks a lot more cognitive behavioral than acceptance and commitment therapy. But acceptance and commitment therapy in particular is very experiential, and is based on mindfulness and acceptance, which comes from Zen Buddhism, going back to the Eastern philosophies, and people like Confucius and Buddha talked a lot about acceptance and mindfulness, and the effect that thinking has on behavior. So if you think about it, Confucius and Buddha were really two of the first cognitive behavioral therapists. It's a bit extreme, but the things they said 2,500 years ago are very similar to the things that our leading psychologists today are saying. So, but But these experiential third wave cognitive behavioral therapies really take it a step further, and that's what I incorporate into body mind behavior therapy, my proprietary approach to cognitive behavioral therapy. Body mind behavior therapy is really a combination of the best of cognitive behavioral therapy, dialectical behavior therapy, and acceptance and commitment therapy. It's got some of the techniques of cognitive behavioral therapy. It has a lot of the structure of dialectical behavior therapy, which I like, and some of the other tools that Dr. Linehan uses. For example, life skills training is a very useful tool and something I incorporate into my therapy and with my clients. And then acceptance and commitment therapy, which is really an experiential approach and takes cognitive therapy a step further. In traditional cognitive therapy, as written by Dr. Aaron Beck, and his daughter Judith, is basically they use what's called cognitive restructuring. You take a thought, you first learn how to catch your automatic thoughts, you learn to be aware of them, and then once you practice and are effective at being aware of your thoughts, you take those thoughts along with a professional such as myself, or if you can do it on your own, which we basically train you to do at a later time. You take those thoughts and basically take them apart and look at them and test them, see if they're valid or not, because a lot of times what our brains tell us, what our minds tell us, really is inaccurate. If we have 50,000 thoughts a day, and you'd be surprised how many of those thoughts are just incorrect or completely bizarre. You probably know what I'm talking about. We all have bizarre thoughts from time to time, and many of my clients, as a matter of fact, come in. The first thing they say, they think I'm crazy. I'm having these bizarre thoughts, about drowning my kids and screaming out obscenities in church or whatever the case may be, and they think that they're the only people in the world that have these thoughts. Well, they're not the only people that have these thoughts. Everybody has those thoughts. It's just that they are bothered by them, and when you're bothered by them and they take on importance, then they become cumbersome, and that's how things like obsessive compulsive disorder evolve. But that's another whole other story. But anyway, I take the best of cognitive behavioral therapy, dialectical behavior therapy, and acceptance and commitment therapy, and combine them and add some things of my own based on my 30 years of experience, 20 years as a licensed professional counselor, and bring them together in body mind behavior therapy. And it really is extremely effective, and it's extremely simple. When I tell my clients about how it works, it's really so straightforward that they say, well, why didn't I think about that before? Why didn't I figure that out before? It's so easy.